Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center, Caring Medical in Fort Myers, Florida. We're seeing people younger and younger having blurry vision, having dry eye disease, having problems with normal eye movement, trouble focusing, light sensitivity, and even loss of vision. If somebody researches visual problems from the computer or the cell phone, what pops up on Google right away is computer vision syndrome and text neck syndrome. So these are all real things that often occur because it's just like the cell phone can be right in front of a person's eye or the computer is too close. But what we see more often is chronic disabling eye problems from a breakdown of the neck structure. When the neck structure is broken down, when there's actual ligament damage. So when a person looks down at a cell phone excessively, the ligaments get stretched out. Unless a person changes their posture and does specific exercises, that neck curve can get reversed, and what happens is you get a brain toilet obstruction or an eye toilet obstruction. Every cell of the body, when it's working, when it's doing stuff, the metabolic activity that you want the eye to do is to help you see. Well, every time you see something, you see an object, the cells are working. Well, the cells, when they're working, they basically poop. They make metabolic waste products. They make inflammatory substances. So imagine an eye for 10 years can't adequately drain the fluid normally, right? There's normal fluid flow into the eye, out of the eye, into the brain, out of the brain. Well, imagine what's going to happen if the fluid, the waste products can't get out of the eye. You're going to get a lot of inflammation in the eye. This can cause all kinds of things such as blurry vision, focusing problems, dry eye disease, cataracts, macular degeneration, retinal problems, floaters, even loss of vision. And basically, you have a healthy eye. Obviously, this is my eye because you could see like the hat and the glasses. And then when the jugular vein gets blocked, waste products can't get out. And when they've done analysis of fluid in the brain and the eye, trying to figure out what's the physiology of Alzheimer's or dementia, the abnormalities or the inflammation or the metabolic waste products occur firstly in the eye typically, then the brain. So ultimately what's going to happen in the brain happens to the eye first. So the same problem, so when somebody has brain fog or memory problems, the analysis is, well, it's similar to what? Eye fatigue, right? You might think, well, eye fatigue, it's not a big deal. It could be the precursor to all kinds of terrible eye things. So I'd really encourage you, if you limit your cell phone and you limit your computer work and you're still having a lot of eye fatigue or blurry vision, definitely come down to Fort Myers, Florida and have us evaluate you. And what we basically find is the nervous system of the eye isn't working correctly. And the tests we do, we look at, is the person's vagus nerves normally? Could their excessive dilation of their pupils be because there's vagus nerve degeneration? Is there excessive fluid around the eye nerve? Is the eye pressure normal? And then, of course, we're going to look at, do you have jugular vein compression? So somebody who has new onset or worsening eye symptoms, but also has neck tension and clicking, popping, grinding in the neck, has a headache, it's likely all these things can be from a breakdown of the neck curve. And basically, ligamentous cervical instability can affect the eye in many, many different ways. Ultimately, it could increase brain pressure, so then there's more pressure on the eye itself. It can cause the pupils to dilate excessively. The pupils have to work properly to see properly. So anybody who the pupil's going like this, like all of a sudden the there's too much light, too little light, or it feels like there's excessive glare. That often is that the pupils are too dilated, or all of a sudden you can't go out in the sun. That's called light sensitivity. That often is caused by cervical oculopathy or a breakdown of the neck curve causing eye pathology. And it can even cause where the ophthalmic artery closes temporarily, goes into spasm, and you can get amaurosis fugax, or you lose vision in one eye for a minute, 2 minutes, and this is common in migraine. What's also common with migraines is visual snow. So if you have visual snow, or it looks like almost like you're in a snowstorm and you can't see an image clearly, definitely come in, especially if an ophthalmologist says everything is normal in the eye exam. And many different eye conditions can be associated with or caused by ligamentous cervical instability and cervical destruction or breakdown of the neck curve, including dry eye disease, retinopathy, optic neuropathy, excessive tearing, papilledema, vitritis, cataracts, eye pain, ocular migraine, scleritis, macular degeneration, ocular hypertension. We've had cases of retinal detachment that keeps occurring that I felt it was from jugular vein getting compressed. And when the jugular vein was uncompressed by correction of the neck curve, the retinal detachment surgery finally took, and of course excessive dilation of the pupils. So if you have an eye condition or know somebody who has an eye condition that just started and the ophthalmologist said everything's okay, or your eye condition keeps worsening, really encourage you to come down to Fort Myers, have us evaluate you, and you may end up having cervical oculopathy, and the treatment is just correction of the neck curve. Figure out how to get your jugular veins open. Sometimes prolotherapy is needed, which are injections that tighten the ligaments, that help the spine get more stable. It's very good at correcting neck pain, headaches, and other symptoms of ligamentous cervical instability, such as dizziness, palpitations, nausea, swallowing difficulties. If associated with your condition is you're having shortness of breath, all these things can be from a breakdown of the neck curve. But one of the most common things we see are eye conditions, but the good news is they respond good to cervical curve correction and prolotherapy treatment program.